Hello everyone. So today we'll be seeing technical round interview question part 4. So if you haven't watched the previous parts like part 1, part 2, part 3, please do check in the playlist so that you will have a proper continuation of the questions. Please make a note of all the questions so that it will be helpful while preparing for your interview. So the question here is, what is a guideline for coding cirrhosis? So for coding cirrhosis, first you should check the type and cause of cirrhosis. If it is not specified, you should give unspecified cirrhosis. If it is caused by alcohol, you should add it. Okay, so that's all about coding cirrhosis. Second question, what is the rule for coding pressure ulcer? So whenever we are coding pressure ulcer, we should look for three important things, that is site, laterality and the stage. Site means the location, laterality is right or left, and stage, it indicates stage 1, stage 2, stage 3, stage 4, unstageable and unspecified. So these are the important things necessary while coding pressure ulcer. Third question, how do you assign stage codes for decubitus ulcer? When coding decubitus ulcer, we should again look for three things in the documentation, that is site of the ulcer, laterality, stage of the ulcer. Stage of the ulcer, usually we have stage 1 to stage 4. Unstageable is there and deep tissue pressure injury is also there. Based on that, you should assign the 7th character. And the next question is, how do you code osteoarthritis involving multiple joints? If a patient have osteoarthritis involving multiple joints, first check whether the provider has described it as generalized or has listed specific joints. If it is generalized, use code from M15, and if it is because of specific joints like knees, hip, etc., use M16. What is the rule for coding fracture? So whenever we are coding for fracture, there are several steps we should follow. That is, first of all, we should determine the type of fracture and then assigning the 7th character based on the episode of care, whether it is initial, subsequent or late effect, and then you should know the laterality and you should check whether any external cause codes are involved in this, and finally you should check for the severity also. Next question, how do you code for CKD and ESRD? Whenever we are coding for CKD and ESRD, refer to the guideline of chapter 10, disease of genitourinary system. If the patient has ESRD, we should assign N18.6. If the provider documents both CKD with stage and ESRD, we will be reporting only for ESRD. Next question, when do you use combination codes for urinary tract infection? Combination codes for UTI when the infection is linked to a specific condition and the classification provides a single code that includes both the infection and the causes. Hereby I have given an example. You can just go through it. In most of the cases, UTI will be coded as a combination code. 8th question, what is the importance of trimester and week of gestation? So pregnancy related conditions are categorized by trimester because the clinical management and risk level can vary based on the stage of pregnancy. So selecting the correct trimester is very important. First trimester is less than 14 weeks, second is 14 to 28 weeks, third trimester is 28 weeks and beyond. So if the week is given, add Z3A code. How do you report pregnancy-related complication? According to ICD-10-CM guideline, pregnancy-related complications are reported using chapter 15 codes. This take priority over other chapters. First, you should check whether the provider documented any complication that is affecting the pregnancy. If so, you should know the type of complication, then check for the trimester. Last question, how do you code neonatal jaundice? Neonatal jaundice is coded from category P59, which is used for condition originating in the perinatal period, that is first 28 days of life. First confirm that the jaundice occurred in the neonatal period, then look for the cause if documented. So in this way, we will be coding for neonatal jaundice. So that's all about these questions, and final part will be uploaded. So totally we have 5 parts. Let me check whether any more questions are available. If so, I'll make a video of that also, so that you can prepare all those questions so that it will be very easy for you to clear your technical round. And if you are looking for placement, interview guidance, CPC training or basic training, you can register with us. We are there to help you. Thank you so much. Take care. Bye bye.